It is often said that one does not know the value of what one has unless it is lost or stops functioning. The human body is one such asset, and each organ of the body contributes to its well-being. Failure of any organ upsets the complete balance. In tune with today's times of reuse and recycle, is it not a criminal waste that the priceless usable organs in the bodies are burnt or buried? That too, when on the other side, thousands of people die waiting for those very same organs. A single human body can give life to many people. Organs like heart, liver, kidneys, intestines, lungs, and pancreas can be donated from a brain dead patient. Tissues like cornea, heart valves, skin, bones, etc. can be donated from a person with natural death.
Being on dialysis is never a patient's choice. My creatinine was 5.5 and I had severe electrolyte imbalance, hyponatremia, nausea, vomiting, headache and loss of appetite. My condition was so severe that I had to get dialyzed at a 5.5 creatinine level. During the initial phase of my dialysis, fluid retention increased, the urea in my blood leading to delirium. My fistula failed because of thrombosis, so I had permanent catheter. After a few months of dialysis, I started getting severe headache. It affected my eyesight. I had 2 cataract surgeries, laser treatment for my eyes, few episodes of shivering, infection and fever, multiple doses of antibiotics becomes a part of my dialysis. Blood transfusion for so many times made me a hepatitis B patient. Post dialysis and lying on bed for 3-4 hours made my body very weak.
For most of the patients, the treatment is out of reach. As a result of the illness and the economic burden, most of them lose the desire to live. As a result of this, they either give up the treatment or go for cheaper dialysis center.
Dialysis is a costly affair. It ruined me and my family medically, physically, emotionally, mentally, professionally and financially. I being the earning member, it was difficult to manage the expenses. Due to leaves at work, my salary was deducted and I didn't get company bonus since the start of my ill health. The medical expenses were so huge that my lifetime limit of medical insurance amount in the insurance company got exhausted. All my funds, LIC policies and saving got used up for my hospitalization and treatment. My wife lost weight, developed anxiety and vertigo. She and my daughter had skin allergies due to continuous stay at hospital along with me. My daughter's education had to be compromised.
Chronic kidney disease are not only emotionally, physically and mentally draining, but also impacts the patient financially. Once the kidney fails, the patient has to undergo dialysis to survive. Not only the treatments is costly, but the medicines and monthly health checkups and other ailments add up to the overall cost.
My dialysis was not easy and my wife used to stand near me throughout the dialysis duration. My body could not bear 4 hours dialysis, so I used to get 3 hours dialysis for 4 days a week. I had a few episodes of chest pain, drop in blood pressure, unconsciousness, and vomiting too. But as dialysis proceeded, even 2 hours of dialysis become difficult to bear for me. My transplant got delayed for a year because of HBV treatment, and again for about 6 months because I was detected with atherosclerosis with 90% blocks in the arteries of my heart. I underwent angioplasty, and this procedure exhausted most of my savings which I had kept for kidney transplant. Unable to bear dialysis, I decided to register for transplant, but very soon I found out that the waiting list take 3 to 7 years, and that too it is on priority basis.
Treatment for end-stage renal disease (ESRD) is very complex. That's why kidney transplant has been suggested. In the case of cadaver donation, the priority criteria depends on age, waiting period, blood group, and to the needy and suitable recipients. So, a recipient with more ailments has very less chance of getting kidney transplant.
It is fear which stops people from being compassionate. A very few percentage of people volunteer for organ donation. In most of the transplant cases, the family comes forward for organ donation, and in other cases, the patient doesn't want to take it from the family as he fears it may hamper their health.
I am a patient on dialysis having diabetes, hypertension, HBV too. My chances of transplant were minimal. My wife was always forthcoming in donating her kidney. I feared taking kidney from my wife will make her a patient too. I feared that her health will get compromised if she donates me her kidney. But all my fears were cleared when her medical condition was thoroughly evaluated.
Organ donation is not an easy task, and the transplant physicians and surgeons are aware of it. Hence, unless and until proper evaluation is done, the permission for donation is not granted. The evaluation of person to become a live kidney donor or a cadaver takes time, careful evaluation, and medical judgment. The donor's organ has to be in good health condition, and also the donor and his family's consent to undergo this surgery is essential.
Finally, 3 years of being in dialysis, I underwent transplant surgery thanks to my wife who donated her kidney. Post transplant, my wife and I recovered reasonably well. She was kept in the hospital for 5 days and was instructed against excessive movement and lifting heavy weight for a few days.
The only reason for restricting donors' physical activity or stress is to avoid any discomfort to the donor. The donors are released in 4 days and they can resume their normal lifestyle. In case of working donors, they can resume their offices in 10 to 15 days. Even in case of cadaver donation, the deceased patient is examined by 4 experienced doctors. The transplant procedure are exact same as that of live donor.
I have to just take immunosuppressant medicines lifelong and follow a healthy lifestyle. The best part is I am free from dialysis.
It is every patient's right to wish for a better life, and hence no patient can be objected of getting kidney transplant if they are willing. Post surgery, the patients are given medicines so as to avoid rejection of the new kidney in the body. These medicines are called as immunosuppressants. After the transplant, the immunosuppressant regimen is very complex and the patient has to take it for lifelong, which is mandatory. Hence, doctors doctors insist on getting matching and compatible donors for kidney transplant.
I am lucky that my wife donated me her kidney and gave me a new life. With our experience, my wife and I urge people to be more open to organ transplant. Organ donation is the greatest deed. It is in our hands to give a new life to a patient. You are not only changing the life of the patient but their entire family by donating your organ.
There are certain organizations like AKC who have taken initiative called HASTRA, whose sole aim is to enable kidney transplant in mismatch cases. Carried out the first domino kidney transplant where 5 pairs have undergone transplantation who couldn't go for normal transplant because of mismatch and incompatible blood groups. The sole aim behind this organization is out of humanitarian consideration so as to increase the number of live donation for kidney transplant and help more recipients to be dialysis free. Similarly, like AKC, there are many organizations who have come forward for organ donation and have been promoting the need for organ donation.
A donor, life or death, deserves same respect and salutation for his selflessness. Thousands of patients are waiting in kidney transplant list, while live organ donations form a minute part of it. Unfortunately, certain myths and fear involving organ donations is stopping people from coming up for organ donation. There is no age bar for organ donation as far as your organ is perfectly functioning and healthy.
Though it is painful to lose a loved one, but donating the organ of their deceased loved ones provides a comfort from the fact that their loss helps to save and improve the lives of others. For a permanent solution and better life, organ transplant is essential. Transplants give a new lease of life to the helpless patients. Realize how essential and vital role we play as the donors.
Let's make a difference for a better future. Donate organ, save a life.
Donate organs. Give someone a new lease of life and let your body parts live after you.
Donate organ, give new life, make a difference.
Be a hero, be an organ donor.
Say yes to organ donation. I did it. I am kidney donor. Donate organ. Save life. Be a hero.